Hi, parents and teachers, or anybody who's involved in the care of a child with ADHD. You probably are feeling overwhelmed just the thought of medication, ADHD on your child. Remember, ADHD is not the lack of Ritalin in a child's brain. It's all about looking at the landscape and a holistic way in which you manage ADHD. Remember, without a proper assessment, it is like shooting a shotgun into a tree and hoping something falls out. I see a lot of children together with their parents who are frustrated with sometimes the management, the treatment of their child's ADHD. They're on lots of medication, multiple medications, and yet they're still frustrated. So it's a maze. Often the thought of you have ADHD and the treatment is just Ritalin or a medication, or parents feel like they really are worried about the impact of medication. So I'm going to try and give you an overview. Obviously, I can never give you medical advice in such a short space of time. It needs a one-to-one and an unveiling and digging in deeper into your family and your child's requirements. Every child is unique and different. Any treatment of ADHD is not a cookie-cutter approach. So don't worry. We've all been there. Today, we're going to demystify for you a step-by-step way in which we can understand this. So let's jump in. What are the types of medication for ADHD? First of all, there are three major categories. There's, first of all, stimulants, and you'll hear the word Ritalin, Concerta, or Amphexxa or Vyvanse in South Africa that we've got now. So the stimulants are into two categories. There's something called methylphenidate, which is Ritalin and Concerta. And now we've got a different category. Although they're stimulants, they work differently. So if your child doesn't react with one, they might react very well on the other. So these are the most commonly prescribed medicines. Then there are the non-stimulants like Strattera. And there are some other minor medications, but we won't get into that really because the major one is Strattera. They work completely differently on the brain and might take a lot longer to take effect. So then we get the natural medications like herbs, remedies, dietary supplements. And I must say, in 25 years of managing children, if you have ADHD, it is a neurochemical problem. The natural remedies don't treat ADHD. And I've never seen a child whose ADHD could be completely managed if they need medication just on dietary supplements, although it's an important part of the holistic management. So how effective are these medications? You might wonder, stimulants or non-stimulants, which is better? Parents say, well, I don't like the sound of Ritalin. Maybe it's Concerta that I like. It's the same chemical. And it really depends on your child. But the overwhelming effectivity is that stimulants are far more effective. The non-stimulants are used often when children can't cope and have bad reactions, or for some particular reason, they have severe motor tics, Tourette syndrome, or they haven't reacted well. Recently, a patient I saw where we had tried a lot of the stimulants and they'd had horrific side effects. And when we started the Strattera, it was like an aha moment. Literally overnight, the child was much better, had no side effects, and had a significantly improved focus, emotional control, and the teacher noticed it immediately, so did the parents. So it's certainly, there's a role for these medicines. And, the stimulants obviously show a much quicker response, but every child, as I can say, is unique. And they need somebody who understands this, who has a feel for the medicine, who can gather the right information. Because more information is better, and you get a far more accurate, kind of unique approach to your child. Remember, if a child's busy, they don't need Ritalin, or if they're big, small, it doesn't go like that. Only the stimulants generally are prescribed by the weight of the child. So, short-acting or long-acting, which is better? You know, for a lot of parents, they're worried about the medicines. They feel like just a little bit of medicine and they prefer the short-acting. But you know, if your child had epilepsy or diabetes, would you want to treat a little bit of their day? And this is when it comes into understanding that longer-acting medicines are far more effective. Short-acting for young children when they can't cope and you're testing them out. But would you want to wear your glasses for a couple of hours a day? So this goes to the heart of the understanding of ADHD. I unfortunately see children that are prescribed medicines only for school, not on holidays and weekends, and for a short period of time. That I know when I see that, those are prescriptions by doctors who don't really understand ADHD. Obviously, there are exceptions, particularly when children are smaller. And they work from 4 to 12 hours and they have different side effects. It's like a speed hump, or the potholes we've got on the road at the moment, is that, you know, the short acting go up and down and they definitely cause more side effects, bigger impact on appetite. The longer acting medicines have broader cover, but every child's different. The younger the child, sometimes the medicine, like the short acting medicines, can be effective. So how about generics or non-generics? Now, just recently, I saw a child who I'd prescribed a medication and they were on the original medicine. And then the pharmacist had substituted for a generic and there was catastrophe. Side effects, lots of emotional ups and downs, bad appetite, headache, stomachache. And that was the generic. Because although they are deemed equivalent, there can be a 25% difference. Imagine if you were given a cappuccino in a restaurant where it was 25%, 1/4 less full. He would be upset. So it depends on the child. Generics need to be used very carefully. Sometimes there are something called clones. You see, a clone is like an identical twin with a different name. So we've got Concerta and Nucon Oros. They're equivalent, made by the same company. But fraternal twins or non-identical twins are those generics. They're different. They're non-identical. And you've got to be very careful. So that needs to be monitored very carefully. And also, we've got to consider, you know, can a child swallow a capsule or not? Just the other day, unfortunately, one of my patients, they cut a capsule, which was the Concerta, in half, and that released everything, and they had major side effects. Some capsules cannot be cut in half. The Ritalin capsules can be decanted, little beads, so we could understand the release mechanisms, and particularly for the younger child who can't swallow. So these are all considerations that we've got to think about. And then, of course, concerns about myths. We get it. The thought of medicating your child can be scary. There's a fear of addiction, side effects, changing your child's personality. You might even feel pressured by the school who worry about your family's history, about medication. You might have addictive personalities in the family. There might be family members who've had alcohol addiction, drug addiction, and you feel like this is this gateway to become an addict. In fact, the research shows that if your child is adequately treated, there's less addiction. So let's look. Your child needs a proper assessment. You absolutely must get a thorough diagnosis first. Understanding is the most important, effective treatment. Because if you can accept and you understand, then you know what to do and what not to do. Issues like emotional or learning problems, we need to have a holistic view. Work with teachers. They are allies, they're not your adversaries. And it's more than just medicine. ADHD is not simply a focus issue. Make sure your child eats well, exercises, gets good sleep. And sometimes emotional or learning issues need to be addressed first. And to remember, a child who has ADHD is more likely in 80% of cases to have a second problem. in 50%, they got a third problem. So if those are not managed, you're not going to truly holistically unlock your child's potential. So sure, I know that was a lot to cover, but I hope this helps you realize that you've got to get the right person, and it's not as daunting as you think. It's got to be monitored, information, feedback. And if you're still uncertain, make sure you see an expert. Don't just get somebody who's going to quickly write out a script and spoken to you for 15 minutes. That is not in your child's best interest. So thank you for watching. And remember, you're not alone. This is something that we can help you with. Please share your questions, experiences, and comments below. And if you have any worries, get in contact me.